the biggest takeaway for the chronic disease HEDIS measure is really making sure that every time that you see a patient in the office that you're doing a comprehensive medication review for them and trying to identify these different medications that they could be potentially taking. So ACE inhibitors, angiotensin receptor blockers, diuretics, and then digoxin, and making sure that if you identify that a patient's on one of those medications that they're getting the necessary laboratory monitoring that goes with that. Also, when you're going through the medication reconciliation for the patients, looking to see are there any medications that we could switch to a lower cost brand or to a generic for a cost savings. So I think it benefits a practice because you do get a good sense of patient satisfaction. I think the patients are very appreciative when they think that you're really engaged in their care, making sure that you know which medications they're on, what they're getting from you, what they're getting from other providers, and making sure that you're doing the necessary monitoring for them. I think patients appreciate that. And then anytime that you can help a patient save money, I think they're always going to appreciate that. So looking for those generic opportunities can be good for them too. If a practice has any questions, they can always contact me. Being the pharmacist for United Physician, I'd be happy to give them some tips or tricks to kind of overcome some of the barriers that can come up when you're trying to do generic substitutions. And we can also provide some resources on how to do medication reconciliation, how to work it into your practice's workflow.